Skin Cancer, Basal Cell Carcinoma by Liz Germano, period 7. What is skin cancer? Skin cancer is the out-of-control growth of abnormal cells in the epidermis, which is the outermost layer of skin. It is caused by the unrepaired DNA damage that triggers mutations, which lead to rapid multiplication of skin cells and also form malignant tumors. The three major types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma. This information came from skincancer.org. Analysis of health problem. What bodily systems would this procedure affect? BCC affects the head, neck, back, chest, and shoulders, but the nose is the most common infection site. This came from uofmhealth.org. What are the tissue organ issues in the disease being treated? It treats skin on the epidermis, which includes the squamous cell and basal cell layers, dermis, subcutaneous tissue, and other parts of the skin. Skin cancer can occur anywhere on the body and is most common in skin that is exposed to sunlight, such as a person's face, neck, and hands. This comes from cancer.gov. How does the disease affect homeostasis? Skin cancer disrupts homeostasis because skin cells proceed too quickly through mitosis and damage healthy tissue. This comes from study.com. Why would a person need this procedure? When detected early, most BCCs can be treated and cured. Early treatment is vital because as a tumor grows, it becomes more dangerous and potentially more damaging, requiring a more extensive treatment. This comes from skincancer.org. What would happen if you needed this procedure and didn't have access to it? If skin cancer is not treated, it can grow larger and cause problems beneath the skin, causing damage to muscles and bones. But BCC rarely spreads to different parts of the body. This came from uofmhealth.org. Analysis of health problem continued. What are the consequences of waiting to have this procedure? BCC is the least dangerous form of skin cancer, but over time, BCC can expand and cause damage to skin and tissues. This comes from myskincare.com. Why does a patient require a follow-up treatment? Follow-up visits for non-melanoma skin cancer, like BCC, are usually scheduled every 6 to 12 months, depending on the type and risk group of the cancer. This comes from cancer.ca. Is there a specific group that usually has this procedure done, like children, teens, the elderly, etc.? Most BCCs typically appear after age 50, but in recent years, the number of skin cancer in people age 65 and older, which qualifies for elderly, has increased dramatically. This came from cancer.net. Is a procedure for diagnostic reasons? Yes. Doctors look and take samples of skin to determine whether skin changes are likely to be skin cancer. This came from mayoclinic.org. Is a procedure used to treat a problem? Yes. During surgery, doctors remove the skin growth layer by layer, examining each layer under a microscope until no abnormal cells remain. This procedure allows for cancerous cells to be removed without taking an excessive amount of surrounding healthy skin. This also came from mayoclinic.org. Description of the procedure. Where is the procedure performed? In a physician's office, same-day surgery center, hospital, etc.? High-risk basal cell carcinoma is usually removed by surgery in a physician's office. To perform the procedure, called a surgical excursion, a surgeon injects a local area anesthetic and then removes the tumor from the skin. This came from mskcc.org. Who or what team performs the procedure? General practitioner, physician's assistant, nurse, technician, surgeon. Surgery is often performed by doctors who are specially trained to fulfill the role as a surgeon who removes the cancerous tissue and as a pathologist who analyzes the lab specimens. And normally, the procedure comes from your general practitioner. Does the team require special training above and beyond what most physicians are trained for? Yes. Many skin doctors, which are dermatologists, can perform surgery, since dermatologists learn about surgery in their medical training, but some surgeons undergo specialized training called a fellowship to learn more about the procedure and become more proficient in BCC surgery. This came from mayoclinic.org. What equipment is needed? Surgeons need an anesthetic, a surgical knife, and stitches. This came from cancer.org. Is this equipment readily available, or do patients have to go to specialized centers? It is readily available since the surgery is performed in the physician's office. Description of the procedure continued. What preparation does the patient need to go through? Patients must 1. Stop taking certain medications that your doctor tells you to stop. 2. Clear their schedule for the day. 3. Wear comfortable clothing. And 4. Bring something to help pass the time, says mayoclinic.org. What are the risks of the procedure? There are many risks of the procedure, some being allergies to the materials used, anesthesia risk, change in skin sensation, damage to deeper structures such as nerves, blood vessels, and muscles, excessive bleeding, infection, poor healing of incisions, and much more. This comes from plasticsurgery.org. What is the likely outcome or prognosis? The prognosis for patients with BCC is great, with a 100% survival rate for cases that have not spread to other sites, but BCC can progress and result in significant morbidity or cosmetic disfigurement. This came from medscape.com. Are there any common alternatives to this procedure? Yes, radiation therapy, topical medications, and experimental approaches such as photodynamic therapy are common alternatives. This came from cancerconnect.com. Is there any special preparation that the patient has to go through for the procedure? Patients must follow doctor's instructions prior to the surgery for the safest and best outcome. I described what patients must do in the what preparation does the patient need to go through question. Personal accounts. For this, I interviewed my mom, Adriana Germano, who has had BCC removal surgery before, and here are her answer to the following questions. How does it feel to get this done? Is it painful or uncomfortable? Is it embarrassing? My mom said it was a little bit painful and uncomfortable, but she was not embarrassed. What can be done to make this procedure easier on a person? My mom says that discovering BCC earlier would help, because the earlier it is found, the smaller the spot is, making the surgery easier and less painful. Is this a procedure that will improve a person's life? My mom says yes. She feels very fortunate to not have any issues with her skin anymore. Is this procedure something that you would encourage a person to do? My mom says 100% yes. How would you convince someone in your family or a friend to get this procedure done? What research is there to support your belief? My mom says that she would tell her story about it and the success of the surgery. After the procedure was performed, she never had BCC or any other type of skin cancer again. There's a lot of research done by doctors and their recommendations of how to take care of BCC and other types of skin cancer. This is the interview video I did with my mom of her answering the questions, and in this video, she shows where the scar that she has from the surgery. This is a video of an actual surgery performed on a person that has basal cell skin cancer, but it's on her forehead. And this is my works cited page. Thank you.